Welcome to The Bridge, the official podcast for the University of Maryland, Baltimore School of Pharmacy Patients Program. The Patients Program is the bridge between the community and researchers. The Patients Program created this partnership to help researchers listen to the community's voice in order to build a bridge to an effective learning healthcare community. Here's your host, Rodney Elliott.
Hello, everyone. Rodney Elliott, Community Engagement Specialist at the Patients Program, here today on The Bridge, talking to two guests that have participated in projects with the Patients Program, one in particular, the Patient Professor Academy, and then another partner, friend, colleague, the Patients Program, who's been with us before I even got here and kind of understands where the Patients Program started, and love to hear her perspective on where the Patients Program has grown up to this point, and also tap in to see what she's got going on, because she was very integral in helping me get acclimated to Patients Program. So without further ado, you guys know me already, Rodney Elliott. I'm going to introduce Lisa Shield and Maisha Thompson. So ladies, how are you guys doing?
Doing well.
I am doing well, Rodney. Thanks for having me on.
Thank you guys for joining me. Really appreciate it. Lisa Shield, you mind giving us a quick intro to who you are and what you got going on?
Yes, thank you so much for asking, Rodney. I would say I'm a passionate patient advocate and engagement consultant working to improve patient outcomes through collaboration so families can have more quality moments together.
Thank you. I really appreciate that. And that your specialty is kind of what the Patients Program is all about, one particular area. And I know you participated in the PPA last year. So as we're gearing up for year 2 of PPA, I'd love to hear your insight on a couple things that happened last year. So we'll get to that. Maisha Thompson, how are you? Would you mind sharing with our audience a little bit about who you are, your early participation in the Patients Program, and then what you got going on right now?
Sure. Well, I am a marketing communication strategist. And as you mentioned, I work with the Patients Program, I think for maybe 3 or 4 years part-time as someone who helped out with the communications and marketing. And I remember, helping to promote the first couple of patients days and things like that. So really been around the program for a while and just always loved the work that you guys do there. And I'm just happy to see all of these new initiatives and new things, particularly the Patients Professor Academy, which I remember when, Dr. Mullins first had the inkling of it. So I was super excited to see it come to fruition and to participate in it.
Lisa, you participated in PPA. Can you share with our audience your experience with the Patients Professors Academy, and if there was anything in particular during your time with the Patients Professors Academy that stuck out to you?
Sure. I think, healthcare needs to speak to people's culture. You can't fill another person's cup until you already know what's in it. And I think that the Patients Professor Program, it helps you to continuously learn. Advocacy isn't something that you can just do in a day. And I love the Patients Professors Program because not only do you learn about the 10-step framework, you also learn about, how to plan research, how to do the research, and how to deliver solutions. And also, all my classmates, we have stayed in touch. We share, through newsletters and sharing information and to bring other classes that we find. And it really has helped me stay engaged, because I think as an advocacy consultant, you see a lot of times that people make assumptions all the time, always making assumptions. And it's easy to fall back into assumptions about patients and their families. So it's always important to remind yourself, you need to constantly think outside of the box about other people who you're not including, and make sure that patients are included every step of the way. So I was really impressed with the Patients Professors Academy for helping make sure that I'm engaging patients continuously as partners. If the engagement's meaningful, are the right patients engaged at the right time?
Mm-hmm. I love it. I'm writing it down. You can't fill a cup until you know what's in it. Me personally, I'm always the guy that's kind of glass half full. So I'm gonna add that to my repertoire when I say, you know what, you can't fill a cup until you know what's in it, because somebody could be drinking water and you pour some Gatorade in it and it just don't fit. It's not gonna make sense. So I love that, and that speaks to how Patients Professor Academy made everyone who attended, no matter if you work in patient advocacy, no matter if you were contracted with the university or a researcher, that you have to understand what's in a person's cup before you try to fill it. I love it. Love it.
Thank you. And I can't take credit for that. It was actually a tribal leader who came up with that, but I thought it was so insightful that I remembered it too and wrote it down, and I try to say it to myself every day, because I think we're so eager to share things, but we have to step back first and, kind of get a lay of what people already know and how they want to learn.
Putting that in, to me, that tribal person, whoever made that up, that makes all the sense in the world, because you put it in a language that everyone understands that. Researchers can understand that. Community members can understand that. People in the community can understand that. So it's not hard to decipher that. And when you're dealing with research, you got to find a way to make people understand it in a way that they receive it, in a way they can understand it. So that's great. Maisha, can you talk to us a little bit about your time before the Patients Program in that marketing space? Because, if you are in marketing, you kind of have to be a part of these meetings. You have to be a part of these sessions to kind of understand what you're presenting from the Patients Program to the community. And what stood out to you as far as the PPA is concerned?
Well, what stood out to me, well, I'll talk a little bit first, like you asked, about my time with the Patients Program in the communications role. And like you said, I really did have to kind of understand what the program was about in order to make sure that I was able to speak to it, to all of the different stakeholders. So everybody from, possible sponsors and writing grants, helping to write grants and pull together things for that, to promoting events and getting the newsletter out, all of those things, and really understanding what's important to all of the stakeholders. So I do know that was always a focus, making sure that we speak to everybody in their language in a way that they can understand. So what's important to our community members, what's important to the organizations we partner with, all of those things mattered. And there was always just this kind of underpinning that we couldn't just say the same thing to everybody. There was always nuance in how we approached each of our stakeholders, and really making sure that happened all the time. So I was always just very taken by that consistent underpinning and just core value of the organization. And I think that really translated into what I loved most about the Patients Professor Academy. There was such a broad range of participants, and that was, to me, was one of the best things about it. I already knew the 10-step framework, but seeing how other people thought about it. So you have someone like me who is, both a patient and, just a novice in wanting to advocate for people who can't advocate for themselves with chronic illness. So I'm just learning the space from that perspective. And what the Patients Professor Academy did for me was get all of these different perspectives from, people who worked at government agencies, from people who, were, if not decision makers, close to decision makers in some of the pharmaceutical spaces. Even down, I was on a call, one of the teams with someone who was in the technology space. So you get to see all of these different viewpoints of how, getting research done and really making sure that we're focusing on the right things and keeping the patient at the core. But you have the patients in the middle, but you have so many different touch points that make everything go. And it was so well represented, and it wasn't an echo chamber. So that was the other thing that I really enjoyed about it. You didn't have the same people agreeing and saying the same things, and I agree with you, you agree with me. It was really that diverse perspective and getting those viewpoints with an open mind that I found just refreshing. And if you were like me, you didn't know a whole lot about it, people leaned in to help explain things about, be it the process on the government side, or how technology incorporates research with patients and things like that. So it was that kind of diversity of participants was probably the highlight for someone like me, who's just really trying to understand on this side of the fence what participating and advocating in research could be.
Even in the work that I do as an engagement specialist, when I go out into the community, I can't just go out to these communities and just talk at the community, talk at the people. You kind of have to come with a listening ear, kind of, see what's in that cup before you try to fill it a little bit. So we took that approach as well. And I understood that some of those breakout sessions that we had were, again, you had a mixture of folks.
Oh yeah, they got heated. They were respectful, but they were heated, but they were heated because of the diversity and viewpoints. Yes. And again, everybody came with an open mind. So even when the conversations did get a little heated, you knew that it was respectful, and it was really bringing you always walked away with hearing something that you might not have, considered, which I think is the most valuable part of the groups, is really just walking away with perspective.
I was just going to say, I also think it's looking at the barriers, right? Because we have these idealistic views on what patient advocacy should be. And we also have to look at the barriers that are in place and how we can overcome those barriers on both sides.
What have you learned during the PPA or heard during the PPA that can help you address some of those barriers in your patient advocacy work?
That's a really tough question. I think one thing that we really need to work on is changing public policy so everyone can have a seat at the table. So that's gonna take a while. But I love how the Patients Professors Academy has created working groups to work on some of these barriers. Also understanding the government regulations on how patients and industry, pharmaceutical companies can interact with one another. There are rules, and we need to make sure everyone understands what those rules are so lines aren't being crossed.
Changing policy definitely could be a long-term approach, and I know the Patients Program is all for that. Like, we're here for the long haul. Maisha, you got some stuff going on over there in Arizona where you're helping folks manage anxiety, depression, and chronic pain. So can you share a little bit about, what you learned or what you discovered during your time with the PPA, or just for the Patients Program in general, and how that has helped you navigate to that next phase where, again, you're helping those folks manage that anxiety, depression, and chronic pain?
Well, one of the things that, I always loved, particularly about the 10-step framework, is everybody says, you have to have a conversation. You have to have a how? Where do you start with this? So I think having a framework as and it's a framework, but it's flexible within it, right? So that's the other thing. But I think just having the how to have these conversations, how do you work with various stakeholders, is so important. And I think that's what, for me, that's what, really kind of digging into it and where it came from, and integrating the personal stories into teaching the framework was integral, because it was like, okay, this is the step, but then here's a story about how this works in someone's life, right? So it was really that kind of balance of, yes, this is a, kind of clinical framework, but they put real lives next to it. And I think that was just an amazing approach in teaching it in the Patients Professor Academy, is kind of marrying those two things up. So it's like, okay, yeah, we're in this world of research, but we know that this touches real lives, and we need everyone to understand that. And I thought that was just amazing. And as far as the work that I'm doing here now, I mean, just kind of following, my heart with something that I struggled with for most of my adult life. And then, as far as anxiety and depression, and really, having to take myself through a process of marrying, pharmaceutical intervention with all of the lifestyle changes and all of the other things that I needed to do just from a health standpoint without pharmaceuticals, right? So really kind of figure out what that balance is between, lifestyle, holistic health, and, other interventions was, it was a long-term prospect for me. And it was a lot of trial and error, and it can be frustrating. And this is from someone who understands health insurance. This is from someone who understands, I understood it, and it was still very frustrating and depleting for many years trying to get, just kind of get through and maneuver. And I know a lot of people who don't even understand that and don't have the agency to, even just call someone to go to appointments with you because you're in pain. Just all of the little things and a lot of steps that I, had to kind of figure out myself. I want to be able to help other people kind of understand what that looks like. And right now, it's funny because I started down that path and ended up in massage therapy and meditation. So I'm now a licensed massage therapist here in Arizona, and I'm opening my own practice. But what I did with that as well is got a meditation certification so that I can teach that along with. So really trying to figure out how to marry those things together and help people to understand how it all works together. Yes, you're on your medications, but you have to do your other things too to kind of, manage what becomes, chronic after a while. So those are things that I'm passionate about, that I'm working towards right now, and set up a foundation alongside the for-profit business so that I can do the work with people who can't afford it. So, those are things that I'm working on right now, but really just understanding that in our communities, people need to understand that there's not this, one approach, this one way to managing these. You have to take a 360 view of it. And it can be hard for people who don't understand it. So that's kind of the work I'm doing right now, along with my marketing stuff. So it's a lot, but it's a heart thing for me, because I've been there, like I said, for many, many years, and getting to the other side of it, you just you feel compelled to reach back and share, and understanding that the research aspect of it is important. You have to lend your voice. Nothing gets better until we're able to, safely and feel confident that, we can do this without being taken advantage of. Being in a program like this, in the Patients Professor Academy, and just the patients program in general, it says, okay, yeah, this isn't the research of the past. This isn't what you have in your mind. Yes. So really trying to change the narrative around that as well, I think is super important. And that's something that I'm interested in, because we all make mistakes, institutions included. But when you have a program like this that's working to kind of, move past those mistakes and really engender that trust, I think it allows people to better understand it and be more willing to participate in getting those interventions and treatments that we all need.
Here at the Patients Program, when we hear someone share something that's exciting or share something that's flat out awesome, we snap fingers here. So I'm snapping my fingers for you, Maisha, for sharing that with us. Congratulations and best of luck with that over there in Arizona. And thank you for sharing your lived experience, because with your lived experience, you're able to go out there and, again, have an understanding for both sides. You sit right in the middle as a patient, someone who has lived experience with it, and also understanding the importance of being a vessel or being a speaker somewhat for folks who don't. And right. I love that. And you're able to kind of step out on faith and bet on yourself. And that's something I know we shared a little bit about during the time when we were here at the Patients Program.
Absolutely.
So I'm definitely totally proud.
Thank you so much. I'm excited.
For sure. Lisa, you sat and listened to Maisha talk about her story about, her being that vessel and sharing her lived experiences. What are you doing now? And has the Patients Professors Academy, being a part of that, helped shape your approach, shape your conversations, shape how you engage with patients, whether they're on the community side or in your research part? Has it, being a part of the PPA, helped shape your approach to some of those things?
Yes, definitely. Like I had said before, sometimes we come with assumptions. And even when we try not to have assumptions, when you work in patient advocacy for a long time, sometimes you fall back on some of those assumptions too. Right now, I have different clients, but one of the clients I'm working with is working on finding new uses for existing drugs that have been FDA approved. Collecting real world data from not only just healthcare providers, but patients, which is really exciting to learn the perceived benefits and risks of using these medications off label. So for example, if you took COVID, everyone sort of now knows what COVID is, and you don't have a treatment out there. And I work in mostly rare diseases where, over 90% don't have treatments. So and it takes so long and billions of dollars to create a new treatment, a new type of medication, that it kind of makes sense to fall on what's on the shelf already, right? That might be approved for a different disease, but it might be able to help us. So we're kind of looking at that and trying to collect real world data in real time. So if I'm a patient and I take something, my doctor has prescribed it off label, that hasn't been approved by the Food and Drug Administration, that if I take that medication, the clinicians and healthcare providers can fill out a form to say, okay, these are the perceived risks and benefits of taking it off label. And I, as a patient, which is really exciting, am going to be able to say, this is what I think is working and this is what I think, is not working with this medication. And putting it on an app to then have anyone be able to look at the app and see what patients and clinicians have thought about these medications used off label and see, is there a benefit to any of these? And if so, should we look at, creating a clinical trial for another indication for that medication?
Is that something that was created or established during the breakout, or when things were kind of new to everyone?
I mean, this app is collecting data on long COVID,
Yes.
and it started in infectious diseases.
Okay.
So we could see, because there's a challenge when you have diseases that are new, but then there's also challenges to diseases that are small. It's not, for a company, it's not sort of always in their best interest to work in diseases that are small, and diseases that are new, it can just take a really, really long time. So, this project is sort of trying to help move the needle forward to find other treatments. And what I love about it is because you're using real world data and information that's interesting to patients. It's asking the patients what they want to hear, right? Like the clinician's form is, clinicians are probably going to be more interested in, quote, comorbidities, like what is eventually going to kill you, or what they specialize in, right? If they're a cardiologist or if they're a dermatologist, they're going to be focused on this one thing. But for a patient, they're focused holistically, and they want to know, how this medication is going to improve their lives, or how it's going to hurt them in every system of the body, not just one place. So, it shows the importance of the patient voice. And, I think I use a lot of the lessons in our meetings when we're bringing all the stakeholders together that I learned from the Patients Professors Academy.
Yeah, I hear the word lived. I haven't heard the word lived experience more ever since I've been here for the Patients Program, and understand the importance of lived experiences, because when I'm out and about in the community or just talking in general, I understand that the doctors and researchers and the professionals, they are quote unquote experts in their field because they went to school, they studied, they had experiences. That's great. On top of that, I love how we make sure that the researchers, doctors understand that the community members or the patients, so to speak, that we deal with are experts in their lived experiences as well. That information is just as important, if not more, when we're talking about coming together, collecting data, coming together, having a focus group, collecting information that's pertinent in changing ideas, changing philosophies, and what you talked about earlier, Lisa, when we first started, is changing policies. So lived experiences are awesome and fantastic, and they help shape research going forward. And I'm proud to be a part of that here in the Patients Program, and excited for year 2 for PPA, which kind of leads me to my next question for both of you. And if I were to ask you a question, Maisha, what would you say to someone who is considering joining the next cohort of the Patients Professors Academy in 2023?
One of the things I would say is keep an open mind. I think that that's very important, particularly when we get into the breakout groups and things like that. Being able to listen critically, I think is important. Also, knowing that you can actually share. So sharing your lived experience in a safe space where it's valued and validated. I think I would encourage particularly patience in that regard, just knowing that your experiences are not taken for granted. I would also, like to say that I'm not, even though I've, marketed and written about medical topics, scientific topics, all types of stuff across the, medical and healthcare and insurance fields, you don't have to be an expert in the science to gain something from this. So I really want to tell some of the, people who may feel intimidated. They might be community members or community advocates who haven't necessarily dug into the science of it all. Be open and approach it with that mind that you don't have to be a scientist. You don't have to be a doctor or a researcher to add value to the program, as well as to get value out of it, because I found all of the material very approachable. And it was, in a way that I think just across the board, the curriculum was built in a way that everybody could understand it. So I want to say that as well. So for people who are considering it, but they just, might feel intimidated by it, don't be, because it's approachable, and you will definitely, gain value, as well as have your lived experiences as a non-scientific or non-medical professional. It will be valued.
Thank you, Maisha. Same question to you, Lisa. With someone that's on the fence, about joining PPA 2023, what would you say to them about joining the next cohort?
Yeah, I guess I agree with everything that Maisha said, and especially having an open mind and, to connect with others. I've had such a great time getting to know my classmates and still go back and ask questions. And also ask questions in the seminars. There are no kind of stupid questions, right? We all come from different backgrounds, and it's important that we all understand what's going on. I think one of the greatest things about the Patients Professors program is the time that they take to define the terms, right? Because if I say, what is advocacy to you, we might all have different answers. So if we kind of discuss, this is where we're starting from, this is how we're going to define it in this class, it's helpful, for everyone. So we're sort of all starting on the same ground. So there's no reason to be intimidated to come.
Well, you heard it here, guys. We have two outstanding graduates of PPA 2022. Both graduated, both took some of the information and knowledge, the stories from lived experience from our community members, I would say, intense breakout sessions, and they've added that to the work that they do. They implemented it in their engagement opportunities with the communities that they serve in their personal projects, but also professional as well. And Maisha and Lisa, I can't thank you enough for participating and joining us on the bridge. I truly, truly appreciate it. And we're going to get out of here. But again, I thank you for your time. Wish you luck in both professional and your personal fields. And thank you again for joining us. PPA was a success last year because of participants like you, and it's going to be a success this year as well.
Thank you for having me on. I appreciate it.
Thank you so much for having me, Rodney. Really appreciate it. Thanks for all that you do for patients.
Thank you for listening to the Bridge podcast. To learn more about the Patients program, visit our website at www.patients.umaryland.edu.